Dr. Khalid Al-Umar. Dr. Khalid Al-Umar is our distinguished guest today. He is a consultant vascular surgeon and chairman of vascular surgery from King Fahad Medical City. Welcome, Dr. Khalid.
Thank you very much. It's really a great pleasure to join you here. It's been an honor. Thank you very much, Dr. Muhammad.
Okay. So our topic today is very important, very common problem is varicose veins. So I will start by asking you, what are varicose veins? Can you define them and mention their types?
To start with, varicose vein is very common in every population. We don't have actual data or numbers about our population, but probably it's anything between 40 and 50% of population affected by some sort of varicose or degree of varicose veins. It is a wide spectrum of disease, so we're not talking about we could start with patients having absolutely no symptoms, no signs of varicose vein, although when you scan them with ultrasound you could see an element or an evidence of varicose vein, to the other spectrum of the disease where it's very severe with skin ulcers, skin breakdown and skin inflammation. Most patients will present in the middle class of these spectrum. So to define the varicose veins, it's a dilated, enlarged and twisted bulging veins, most commonly affecting the legs.
Are they the deep veins or they are under the surface of the skin?
So people tend to see the one obvious for them in the legs, like in the surface area of the skin, just underneath the skin, or the deep ones usually tends to cause more symptoms rather than the superficial one or the one just under the skin. So you could have a spider vein, a small red, purple veins, or a large twisted bulging veins.
Okay.
This is the surface veins, we call them surface veins.
Okay, but this is different from deep vein thrombosis?
Yeah.
Or?
So veins in the legs, so let's define what is veins first, so everyone will know what is varicose veins. So we have two tubing system in the body that carries blood. The arteries bring the blood from the heart to all over the bodies. The veins take the blood from your part of the bodies and returning them back to your heart. So varicose veins affect these veins. So you could have varicose veins anywhere in your body, but most commonly affecting the legs, because with upright position, prolonged standing and sitting, blood tends to pull down by gravity in your lower part of the body, which increases the pressure in your veins and causing them to be varicose.
I think that just leading us to the second question, what are the commonest symptoms or symptoms of varicose veins? How do patients present, okay, to the physician?
Okay, so it could be asymptomatic. It doesn't cause any pain or it doesn't bother the patient at all. So most people will present with the way it looks, like for cosmetic reason. Like, I have these abnormal veins, can you do something about them? And it depends on the type of the varicose vein and the grades of the veins. When it causes symptoms, most commonly is pain, heaviness, cramps in the legs. As you go more severe on the scale, you could have skin inflammation, discoloration of the skin, inflammation of your veins, till you get a breakdown in your skin, which we call it ulcer.
Ulcers.
This may indicate a serious circulatory problem, so you have to address the doctor right away to solve this issue.
You mentioned cosmetic parts, so does it affect females more than males? Because this is very important for ladies.
Definitely. The women tend to have more incidence of varicose veins than males, because of multiple factor pregnancy, hormonal changes that could affect, has an effect on the veins. So they do, yes.
They do, okay. So is there any risk factors or causes for varicose veins? Family history, is it important or?
Yes, 60% of patients or people who attend to the clinics with varicose vein, they have a positive family history of varicose veins. So genetics factor is really important. Other risk factor that may lead to varicose veins, including obesity, age. As you progress in the age, your veins tend to become less elastic, so you lose the function of the valves that prevent the blood from going in backwards direction. Hormonal changes, pregnancy, these are all factors in causing varicose veins. And when you have a blood clot in your veins, you might develop varicose veins as a complication of this.
Deep veins, the blood clot in the deep veins.
Yes.
Okay.
Yeah. So there is two types of veins in your legs. The deep veins, which is really like close to the bone and surrounded by the muscle, and there is a superficial veins
under the skin,
above the muscle. These are most commonly affected and the cause of the varicose.
So if you have obstruction of the blood flow in the deep venous system, so the blood will flow in the superficial veins. That's why
we'll have an alternative pathway. The blood has to find a way to return to the heart. So it will find its way through small channels to flow in this superficial venous system. Eventually this will cause the varicose vein.
Sure. Does incubation affect, the disease? Is there any certain kind of incubation increase the risk? Or
So as a risk factor, or people who tend to stand or sit for a long time, they tend to develop varicose vein eventually late in their career. So that's why I really recommend people whose jobs require them to stand for a long period or sit on a chair for a long period to have medical compression stocking, trying to restore the venous anatomy and hopefully preventing the development of varicose veins.
So not only standing, prolonged standing, even sitting
in a chair will cause, because your leg veins, you have down in the legs there is a vein. So gravity tends to pull the blood downwards, which is actually the flow of the blood will go upwards to your heart. So and you're acting against the gravity.
Okay. Thank you, Dr. Khalid. Now we'll go for a brief report about varicose veins.
I am Arij Al-Mutayri, vascular technician in King Fahad Medical City. We are here today to introduce our new treatment in varicose vein treatment that was launched yesterday by Dr. Khalid Al-Omar and a team of the company from Medtronic. With the help of head of the department, Dr. Fahad Al-Ghufayli, head of the cardiac center. We will talk about the new treatment that exclusive now in King Fahad Medical City available. It's the varicose vein glue. They call it Venacil. We can explain a small introduction about this treatment that easier for the patient than previous treatment, that laser or radio frequency, and with painless and much better prevented. Venacil treatment is different than previous treatment for the varicose vein. Venacil technique is using a small glue that introduced inside the veins, and by a special technique and with a special dose regulated by this machine, it will be inside the veins and with a small compression, so to stop the flow inside this vein and glue it out. It's much simple and easy to use.
Doctor, can I ask a question? How long does it take for the procedure?
The actual procedure is around 15 to 20 minutes. But we will always still half an hour just to prepare the patient and make it in a sterile fashion.
And of course, is there any pain or symptom going to happen after the operation?
Patient will be under small local anesthesia and he can go home at the same day. No pain during this procedure.
Any side effect for this operation?
Actually, they have some small incision, so from this incision you will not have any side effect. Apart from the long-term scanning, this will be followed up by the doctor in the clinic. So hopefully no complicated.
I'm Dr. Khalid from Department of Vascular Surgery, Assistant Consultant in King Fahad Medical City. So basically we have started this procedure here in King Fahad Medical City under the Department of Vascular Surgery, which is the latest treatment for varicose veins, which was basically invented recently. And we have started this in our department, and we have done around 6 cases yesterday. The treatment is there is this glue which we are injecting into the varicose veins with the help of this gun, and there's this catheter which we put inside the vein, and with the help of this we inject this glue all the way into the vein, and this has been found to be very cost effective overall. If we compare the hospital stay and the need of anesthesia, comparing this, it is very cost effective, and then it is very without complications to the patient, and the patient can return to the work very soon after this procedure is done, and there is no need of even admission to the hospital. So that is it about the procedure.
Thank you so much for your time, sir, and thank you for the information.
You're welcome.
Welcome back, Dr. Khalid. Would like to continue our interview about varicose veins. How we can diagnose varicose veins?
So if you suspect that you have a varicose veins, so first thing you have to go to a specialized person where they can reach a diagnosis, then treat you. Basically, as any medical condition, it starts with asking the patients about questions about his complaints, pain, describing the pain. A lot of patients, they have a combined pain. They could have a pain from nerve compression in the lower back, combined with a pain associated with varicose veins. So elicit more about the pain, that this is the actual, varicose veins is the actual cause of the pain. Examining the legs while standing to see and evaluate what kind of varicose vein the patient has. Then as a confirmatory test, we have to do an ultrasound to scan the legs veins and document there is a blood flowing in a backwards direction that causes the varicosity.
So the gold standard is ultrasound?
Yeah, it's a duplex ultrasound for lower extremity venous system.
But has to be supported by history and clinical examination, like any other condition.
Yes.
If they don't get treated, what complications they might have?
Again, it depends on the grade of the veins. If they are like just spider veins, usually these are cosmetic and it doesn't cause anything. Some spider vein could cause pain and progress to cause reflux involvement of the deeper veins. These are the patients where you have to treat. if only spider veins treatment, and you after confirming that there is no disease involving the deep veins, you could do a sclerotherapy. Is a good option. Sclerotherapy is just injecting a small a material inside these spider veins to close them and scar them. If you have a disease in the main superficial veins, then this is a different treatment. Before treating the obvious varicosity or varicose veins, the one you see in your legs, these are the branches of the superficial system, the main veins. So you have to address the cause first. So treating the cause has many type of treatment. We started with surgery, the ligation of this main vein and take it out stripping. That was first done in 1905, and as time goes, like a lot of advancement in this type of the surgery. Then recently, till the early 2000, thermal ablation or heat by laser or radiofrequency, where we introduce a small tube in your superficial veins that is refluxing, or the blood is moving in a backwards direction. So you heat these veins with a laser or radiofrequency and close them is the main line of treatment nowadays. Till now, based on the data and all recommendation of international medical society, they really recommend laser treatment or radiofrequency over surgery. As
so this is the first line.
This is the first line, yes. When they compare it in large studies, when they compare it to surgery, patient will have less pain, less recurrence rate, and they go back to their usual work in a day or two.
So is it, the surgical removal or stripping, is it done nowadays in the presence of the new technology?
It's still valid, but in less than 1%. Less than 1% of patients you really require to do stripping or ligation of these veins. Another type of surgery where we call it phlebectomy is a small incision over these bulging veins, and you remove them. It's a tiny incision, like a millimeter probably incision, and you remove them. This is different than stripping. This could be done as a complementary to surgery or radiofrequency treatment.
Do we need general anesthesia or done under local anesthesia, all the procedures you have mentioned?
These are done under local anesthesia, usually involve a lot of local anesthetic agent along the leg. A new modality of treatment has been introduced lately. We've seen a result, not a long-term result, but result like over 2 years with good, really comparable result as laser and radiofrequency, is the medical glue. This is purely local anesthetic, where you just freeze a small area of the skin in the leg, introduce this tube or the catheter to the vein, and inject this glue while coming back and glue the vein.
That's very interesting.
This type of procedure, this kind of procedure, the patient will go home immediately with no stocking to be weard after the procedure.
So this is a daycare procedure, or
an office procedure even, not...
not require admission or hospitalization to hospital.
All these procedure could be done as a day case or an office procedure. If you do have facility to do it, to do them in a day case or on a sterile condition, that would be better.
Good. Are they, safe procedure? Are they free from risk or any complications of these procedures?
Any procedure has its own complication. So they do have some possible complication, but it's extremely low. The most serious complication is having a blood clot in your deep veins. And why we're doing the procedure to start with, because varicose veins are a risk factor for developing blood clots in the deep veins. But saying that, like leaving the veins, you will have higher risk of developing blood clot in the deep veins rather than when you compare it to the percentage of the procedure. So they do have some inflammation of the veins, which is really minor. We could control it with
Phlebitis. Okay.
yeah, with medications. They do have some bruises over the area treated. These are self-limiting and will go away within a week to 3 weeks usually. So there is no really much major complication of this procedure. So it's yeah, in general, it's very safe procedure.
Okay, safe procedure. And less invasive compared to the previous.
Surgery is you do it under general or general anesthetic. After the procedure, patient will have a lot of pain comparing to the laser or radio frequency. There is no comparison between patient comfort between these two procedures.
So it's really a breakthrough, in the management of varicose veins. Will they recur or come back after treatment by radio frequency, or glue, or each one? What's the risk of coming back after?
So there is a risk of having them back after the procedure. There is always a risk. The risk of recurrence, or you have the varicose veins back after the surgery, is higher when you do a surgery, the standard stripping surgery, compared to the thermal ablation, which is intravenous laser or radio frequency. But they do recur probably in 15 to 20%.
Okay, so
after the laser.
15 to 20% after the laser.
Yes.
And what you will do next after, if you have, let's say, coming back, the same treatment, or you will switch to another?
No, you could do it again. That's the beauty. You could do this. You have to again do an ultrasound, see, because the recurrence or the having the veins back, it could be from the other vein other than the one you treated. So they could develop a new varicose vein. So you could still do laser, radio frequency, or a sclerotherapy for the recurrence, or you could do a laser to the same vein again.
Same vein, okay.
Yes.
So we focused mainly on the surgical, approach. Is there any non-surgical or medical therapy or treatment for varicose veins?
To treat them medically, no. I mean, you cannot have the veins disappeared by only medications, or so you have to do some sort of procedure for them. But this is a question I always ask my patient: what's bothering you about this? If it is pain, I really recommend them to have the procedure done. If not, some will prefer not to have anything, so I advise them to wear a compression stocking.
Compression stocking?
Yes, compression stocking whole day, and they take them off.
Is it like the regular stockings in the market?
No,
or
it's a medically designed stocking with a pressure gradient. So you have a higher pressure at the ankles, and as you go up, the pressure reduce, so that it will pump the blood upwards.
Okay, it will improve the circulation and blood flow.
Improve the circulation, exactly. This is not a treatment, but it will help ease the pain.
Symptomatic.
Yes, and it will help it will keep your veins at the same status quo. Will not progress, but it will never treat the veins. That's why people with high risk, we always advise them to wear a stocking, a medical compression stocking.
Got stockings. Anything else apart from stockings, like painkillers or leg elevation, or?
So stocking, exercise, strengthening the muscle.
Oh, that's very important.
Yes, leg muscle and thigh muscle. These muscle, we call them calf pump. Muscle. So when they contract, when you have a strong muscle, it contracts and pushes the blood upwards. So you're preventing the occurrence of increasing the venous pressure and high risk of varicose vein development.
So this exercise, that's very important. Exercise prevent, varicose veins, occurrence. If you have varicose veins, you can exercise also, and
yes.
Either way. So exercise can prevent and
improve your circulation and improve your symptoms as well.
Any kind of exercise, or
strengthening exercise to the muscles and the legs and thighs.
I think we'll come to a very important point. how we prevent varicose veins, and what's the relationship between varicose veins and obesity? Okay, is there any relation?
Obesity is a risk factor for developing a varicose veins. So you put a lot of pressure when you're obese on your veins, lower veins in the legs. When you reduce weight, this pressure will improve. So the pressure of the fat on the vein itself, on the lower part of your body, like in the pelvis and in your lower belly, the fat will compress the vein and prevent them from the flow back towards the heart.
Excellent.
So reducing the weight will help in getting the
important.
blood flowing in your legs, and instead of having the blood just stagnant in your legs.
Thank you, Dr. Khalid.
You're welcome. Thank you very
Now we
much.
will have another report about treatment of varicose veins.
Dr. Nashwan Al-Attab, Assistant Consultant Vascular Surgery, King Salman Heart Center. Today we have a new technology which is called the VenaSeal, which used for treatment of varicose veins. Varicose vein is simply a dilated veins, tortuous veins, which is very common to see in our practice, and many patients comes to clinic seeking for help. This technology is invented recently by Dr. Rabi, is vascular interventionist from USA. This technology, if you can see this in front of you, the device. Basically, this machine depends on using super glue, as you can see here. This super glue will we put the vein, we put this material inside the vein, and then we compress on that vein. We seal the vein. So this is a really this attractive way of management, because there is no need to put the patient on general anesthesia. Patient can return to work early post surgery. No pain, no bruising, no heat. In comparison to the older technology, which is laser and radio frequency. It's really impressive. Yesterday we have done like 6 cases, and all patients were discharged immediately post procedure. And really, this is save a lot of money. And regardless, this material is a little bit more expensive than laser. But if you compare, if you think from the other side, I think it's save a lot of money, because you can do it on in OBD in a clinic. So no need even for OR, no need for anesthesia, no need for admission, and the patient can return to his work immediately. So this is really advantageous, and also from economic part view, is saving a lot of money to the to the institute, to the country, and I think we're looking forward to start to do all cases using this technology.
Doctor, let's talk about the procedure itself. How long does it take?
It takes from the start to the end of procedure about 15 minutes. And this is really because you don't need to put the patient in anesthesia or to put a patient on sleep. The patient is awake. Only do local anesthesia at the site of the vein site, at the surgical site, and then you proceed, and the patient is fully awake, no pain, no heat, and immediately, and also doesn't need stocking, elastic stocking to wear for a long time, and no post-operative medication even. Maybe simple anti-inflammatory drugs he needed for a couple of days, like paracetamol or something like this. So I really recommend I recommend all vascular surgeon and all institute to have this technology.
Is there any side effects to this operation, sir?
No, not at all. There is no side effects. The only thing, you have to know how to use it properly. Otherwise, if you cannot use it properly, you may need to use more than one device. And this is the only the side effect, or the only disadvantage. This is very expensive, so you have to use it properly. For patient, there is no side effect at all. If you have varicose vein, you have to go to the proper surface, proper surgeon who is familiar with the new technology. This is my message.
Doctor, we thank you so much for your time. Thank you so much for having us here. Wish you all the best.
You're welcome. Thank you so much.
Conclude by the last question about a patient with varicose veins who presented to my clinic complaining of feeling like a rope under the skin with redness, okay, and warmth over the overlying skin. So what's this, okay?
So these are some complications of varicose veins. So a long-standing varicose vein which is not treated even by stocking, trying not to prevent progression.
So severe varicose veins, not any varicose veins, they have this complication.
Excuse me?
In severe varicose veins.
Yeah. So in severe form of varicose veins, you tend to have inflammation of the skin around it, especially around the ankle. Eventually, when the pressure builds up in the skin and in the tissue underneath the skin and becomes scarred, the skin will break and form an ulcer. It's very painful. That indicates the severity of disease. At this condition, you have to seek a medical attention immediately. And even before this, when you have a skin discoloration, the skin becomes very dark purple in color. So that's a sign, or a predictive sign of you probably will have a serious problem down the road. So you should address this immediately and seek a medical attention. Other possible complication is a blood clot. You could develop a blood clot in the veins, on the varicose vein just underneath the skin. It's very painful. Usually is not a serious issue, but still you have to attend, seek medical attention to evaluate this and see whether this blood clot progress to the deep veins. Where when you have a blood clot in the deep veins, which is also a complication, is a serious problem. You could have this blood clot travel from your legs to your lung, and sometimes it's very serious.
Excellent.
Yeah.
So these are the most serious complication of the
bleeding.
Okay, thank you, Dr. Khalid.
You're welcome.
It was very informative episode, and I would like to conclude by the last report about health benefit.
Protect your body by eating grapes every day. Eating grapes every day can provide us with several health benefits. These exquisite fruits enclose an entire treasure trove of sweetness and healthful properties that are worth getting to know. Among their many benefits, grapes boast anti-carcinogenic capacities and also help us fight fatigue and kidney diseases. Their properties vary according to the type of grape. Want to know more? Both red and green grapes have their own particular properties that we can take advantage of, so don't pass up the opportunity to purchase grapes at any season in your market. The benefits of grapes. Red grapes were highly utilized and valued by the Greeks and Romans. They are exquisitely sweet and nourishing, and they contain a few special abilities that we're going to list below. They prevent cancer. This attractive red color tells us beforehand that they contain a large dosage of antioxidants. a fantastic amount of free radicals that are joined with phenolic compounds, which is excellent for fighting against cancer. They prevent cardiovascular disease. Their components, like anthocyanins, tannins and flavonoids, are perfect for heart health. Their vasodilator effect prevents sediments from accumulating in the arteries, thereby preventing problems like arteriosclerosis. They prevent constipation. Red grapes contain a very characteristic dosage of fiber, which acts as a laxative whenever consumed with the skin and seeds. They take care of the stomach. Drinking grape juice helps improve digestion. They prevent infections. Red grapes have strong antiviral and antibacterial properties. They are excellent blood and organ cleaners. Folic acid. Nutritionists advise pregnant women to consume red grapes in the first few months of pregnancy. They promote cell division and proper child gestation during those first few weeks. It's important to note that red grapes' high sugar content is not good for diabetics. Benefits of green grapes. The good thing about this variety, the green grape, is that you can buy it all year round. If they're at a good price in your markets, try to buy them regularly, whenever possible. Low in fat, green grapes have less sugar than red. They are rich in carbohydrates and taste a little acidic. Cholesterol and sodium free, they are perfect for good kidney, liver and intestine functioning. They have large amounts of potassium and are perfect for a lot of diets. Rich in minerals, especially iron and potassium. Thanks to this, they can reconstruct tissues in the body, improving heart function, and simultaneously stimulating the production of red cells that help oxygen circulation in the body. Prevent colon and prostate cancer, and Alzheimer's. All of these benefits are due to resveratrol and catechins, potent antioxidants for the body that, according to several studies, enormously benefit the preventive power of these illnesses. Cares for bones. Thanks to the vitamin K and vitamin B1, green grapes help keep bones healthy longer, and in perfect conditions. How many grapes do I need to eat to improve my health? It's best to consume grapes daily. Choose whichever one is most beneficial for you, green or red, or whichever one is easier for you to get. It is a good idea to eat one bunch of grapes a day, or if you don't have them, 1 glass of recently prepared juice after your main meal. Remember that including the skin and seeds is much better for constipation, but you could avoid doing so if you make a smoothie. Over time you will begin to notice the difference in your health. There are a lot of studies that support the incredible health benefits that green and red grapes provide.
Welcome back. There was wealth of medical information to keep you healthy. Our main topic today, varicose veins. They are common and they can cause cosmetic concern, but we have effective and safe treatment options, and I hope to see you next week, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.